Hey, good morning and welcome back. You are currently listening to Momentum with me. My name is KG, and right now it is Health on TRAXX. Our topic today is ending cervical cancer, and our guest today is Dr. Shazimah Abdul, who is a public health physician, and our producer today is Mr. Barit, and on Facebook Live we have Chinta as well as Rose. Right now though, let's get Dr. Shazimah on the line. Good morning, doctor. Hi, good morning, doctor.
Hi, morning.
I hope you're having a good day today.
Yes, definitely.
And of course, it's the precursor to a public holiday tomorrow, so I hope you are having a lovely day today. And let's get on with the question, shall we?
Okay.
Today we are talking about ending cervical cancer, and first things first, what is cervical cancer and what causes it?
Okay. Cervical cancer occurs when abnormal cells lining the cervix starts to grow uncontrollably. Okay. The cells is cervix actually is the opening to the vagina from the uterus. Okay, cervix, I guess everyone knows that connects the body of the uterus to the vagina. Mm-hmm. So these abnormal cells will first develop into precancerous changes before it finally develop into an invasive cancer. However, the process takes a very long time, a period of 20 to 30 years.
Wow, that's a very long time.
Yeah, very, very long time. So it gives you a long period of detection. You can actually do screening before you finally develop cancer. Mm-hmm. So in Malaysia, cervical cancer is the third commonest cancer among women after breast and colon cancer. Mm-hmm. Mm-hmm.
And the causes as mentioned?
The commonest cause of cervical cancer is HPV. 90% of cervical cancer in the world is caused by HPV, the human papillomavirus.
All right, and that is why ladies and women are suggested to take the test every year.
Not every year, actually. Mm-hmm. If you want to talk about the screening method, or
I mean, like, how often are they suggested to take HPV tests and all of that? Okay,
it depends on the modality used. If there are basically in Malaysia, we have two methods of detection. Mm-hmm. Okay. First is the Pap smear. Which has been introduced in Malaysia since 1969. Mm-hmm. Right. Pap smear for the first time, for first year, if the result is negative, you have to repeat it after the first year. Okay. Mm-hmm. After the 2-year result negative, so you only have to repeat it 3 yearly. Okay.
Oh, okay.
All right. Mm-hmm. But now we have another method, which is the HPV test. Okay? HPV test is very interesting. Okay, which you can the women can do it herself, which is called as self-sampling method. Mm-hmm. But it is not done at home. Okay, but you have to come to the nearest clinic. Mm-hmm. We offer it to. We haven't launched it nationwide. There are selected states conducting this test, where this test detects the HPV virus.
Wow.
Yeah. So it is still new. Okay. Mm-hmm. But once the test is negative, the woman can only have to do it every 5 years.
Wow, that is amazing.
To the very amazing. You only have to come every 5 years. Mm-hmm.
And this is like brand new technology that's going to help women out there.
Yeah, it's still new. Mm-hmm. In Malaysia, it's still new.
All right.
Australia has done it for many years.
Okay. So, of course, it's very good news that right now we have such a test coming in, and women out there, they can go for the test every 5 years, and they have a better, accurate understanding as well about the HPV.
Higher sensitivity. Yeah, this test is also have a higher sensitivity compared to Pap smear.
Wow, that is amazing. Now, of course, doctor. Now, who is at risk of actually contracting cervical cancer?
Okay. Of course, when you talk about cervical cancer, women who have had sexual intercourse are at risk, especially those women who are 30 to about 70, 34 years old.
Mm-hmm.
Those who are not married are not exposed to HPV virus.
Oh,
so
okay.
those women are not at risk. Only women who are married or who have had sexual intercourse are at risk.
All right. What are some of the factors that actually increase the risk of cervical cancer?
All right. Very good question, KG. Okay. Initially, I only mentioned about HPV virus. So the other risk factors are those who are sexually active at young age, those who are 70 years or younger, so who had initiated sexual intercourse younger. Okay. Okay, and those women who have multiple sexual partners, more than 3. Why? Because they are exposed to HPV, at risk of exposure to HPV. And then those women who had first delivery at young age. Other risk factors are like smokers.
Okay.
Why? Because of the chemicals in tobacco have been found to cause damage to the DNA of the cervical cells.
Okay.
When the cells are damaged, these may contribute to the development of cervical cancer.
Wow. I mean, you wouldn't actually see the correlation between cigarette smoking and cervical cancer, but it seems like it is just as big as a risk.
Yeah. Because studies have found this correlation.
Wow.
And also women with a weakened immune system, like HIV or women with autoimmune diseases, are predisposed to HPV infection. Because when your immune system is impaired, HPV infection is difficult to fight off. You can't fight HPV infection. In addition, a precancerous lesion, this lesion which comes before you develop cancer. So this lesion can develop faster than if in a normal women.
Especially for those with autoimmune diseases.
Yes, and also women with HIV.
Oh, okay.
Yeah. And furthermore,
Go on, doctor. Go on.
Okay. Furthermore, women with sexually transmitted infection, like women with chlamydia, gonorrhea, herpes. So once you have this sexually transmitted infection, you have this tendency to develop persistent HPV infection, and you may progress to cancer.
Okay. So essentially, there's a whole bunch of extra risks, extra factors that can actually increase the risk. And of course, just doubling back on testing for just a moment, doctor.
Okay.
It is said that many women are still being untested for cervical cancer.
That's really, really true, KG.
Is it uncomfortable for women to actually take the test? Can I have your advice on that?
Okay. If you're talking about pap smear, okay, it is done by the health staff. Okay, it might be causing slight discomfort. Okay, I'm saying slight, but it's not painful.
Okay.
Okay, but if you're talking about HPV test, okay, you need to insert a small swab inside a vagina, inside a woman's vagina. So you're going to do it yourself. So you know how far you're going to go. So you know when to stop. So it's not going to be painful. It's very quick.
Yes.
Less than 5 minutes. That's it.
It's just like the test that we do for ourselves for the COVID-19 test. Just use a swab.
That's true. Yes.
Yes. And the thing is, does of course, sometimes women out there, some of them are shy still to go in regards to anything that has to do with their cervical issue or something like that.
Especially, yes. Yes.
Is that actually another reason why women are still a bit scared to go to a doctor to see to get themselves a pap smear or a HPV test? Does that still factor into the account?
Yes, that's true. And another factor is because you're afraid to find out what's wrong with you, right?
Yeah, a lot of people do believe that ignorance is bliss.
Yeah, but but you should know what's going on, right?
Absolutely. Because cervical cancer, it is a very, very scary thing.
Yes, once you know that. Any cancer, not only cervical cancer, any cancer.
Yes, absolutely, doctor. Now, how can a woman actually find out whether she has cervical cancer?
Okay. Because women with precancers or cancers at initial stage, usually they don't have any symptoms. They're like any women out there. Okay. Usually symptoms are only present when the growth becomes larger and they invade the adjacent organ.
Oh, right. Okay.
That's why women, you can't blame the women now, because they don't have any pain or any bleeding at early stage. All right. So when the mass gets larger, so this is when the most common symptoms occur. Like they started to have abnormal vaginal bleeding. They started to have bleeding or spotting between menses. Period might be longer or heavier than usual. They might be bleeding after having sexual intercourse, or those who had reached menopause, they started to have postmenopausal bleeding. Or sometimes we might have this abnormal vaginal discharge. The discharge might contain blood or foul smelling, or when they have sexual intercourse, there might be pain, which they usually don't have. Okay, or there might be pelvic pain at the lower abdomen.
Wow.
So they might these symptoms might trigger them to that they might to get checked out. They need to go to the nearest clinic for further examination. So this might trigger them. I might have something. So they need to go to the doctor.
Absolutely. And if they even feel anything out of the normal.
Yes, the normal, they have to get checked out.
Now, since cervical cancer doesn't actually cause any pain until it is in a much later stage, it is all the more reason why women should always go for the testing, right? And
that's why we advocate screening. Yes, we advocate screening because it can detect any abnormal lesion earlier,
much earlier,
cancer or cancer.
And can you advise on just doubling back on the earlier question, should shyness actually be an issue?
Sorry, I can't hear you.
Should shyness, like of a lady or a woman meeting a health professional, should shyness actually play a factor there at all?
I think so. Because we from our side, we try to advocate all women to come forward. Not when you have symptoms. We help promotion not only at the clinics, but we send messages to our FB, Bahagian Pembangunan Kesihatan Keluarga, Facebook, our Instagram, with messages for screening, not only when you have symptoms, but when you have to do it routinely. Once you are negative, you only have to repeat it every 5 years.
And of course, doctor, now this is something that you know very well. Cervical cancer is the third most common type of cancer in women in Malaysia. However, only a small percentage of them have had a pap smear test. Cervical cancer, in addition to breast and ovarian cancer, is actually a major health concern for women in Malaysia. This is according to Deputy Women, Family and Community Development Minister Dato Sri Zailah Muhammad Yusof. What are your thoughts on the government's announcement in Budget 2022 of 11.5 million ringgit for breast and cervical cancer screening and tests across the country? And can you further describe the detection process, amounting from that?
Okay, thank you. I really agree that we should focus on breast and cervical cancer program, because, of course, we all know that early detection saves life.
Absolutely.
Okay. Yes, and as I mentioned earlier, that detection like pap smear, it focuses on detection abnormal cells on cervical cells, while HPV detects DNA of high-risk HPV.
Okay.
Okay, because HPV, there are two subtypes of HPV. There are two major groups, low risk and high risk. Okay, you don't worry too much on low risk HPV. Okay, because it doesn't cause cancer. But high risk ones, there are currently about 15 subtypes of high risk HPV, which causes cancer.
That's a lot.
Yes, there are a lot. But the biggest culprit is the HPV 16 and 18, where 70% of cervical cancer are caused by this HPV 16 and 18.
Okay.
Okay, that's why our tests detect this high-risk HPV. So when you're positive, when the women are tested positive, there are further testing, which is called colposcopy. It's like a microscope, which enlarge the cervical cells to see whether there's abnormality to the cervical cells.
Okay.
So if there's abnormality, there will be biopsy taken and to see what are the cells, what are the abnormal cells. And if you need treatment, we'll give treatment appropriately.
And of course, what treatment options are actually accessible to the patient in the case of a positive result, doctor?
Okay. It depends on the pathology, okay, and the staging, okay. If early stage, of course, you need surgery, okay, and followed by radiotherapy and chemotherapy. But if too advanced, you might need radiotherapy and chemotherapy.
Of course.
But the prognosis depends on the staging. Like I mentioned earlier, 41% of women presented late stage 3 and 4 already advanced. So that's why our survival rate is 51% after diagnosis survive after 5 years. So it's quite not good.
Yes, because they do present themselves to the health professionals at a very late stage.
Yes, I understand because of early stage women are asymptomatic. That's why we want to advocate on early screening.
Okay, yeah, definitely. Doctor, if you don't mind me asking, what the staging time frame, like between stage 1 and stage 4, like usually how long does that take for the cases to happen? Like from stage 1 to stage 4, how long does it usually take?
Different patient, different.
Okay.
Yeah, we can't say.
Now, is it possible to actually prevent cervical cancer?
To prevent? Oh, okay. Okay, in preventing cervical cancer, because I mentioned earlier, it is one of the preventable cancers. Okay? Yes. Because it takes years to develop.
Absolutely.
And it gives you ample time for screening. So there's HPV vaccination, which we give for 13-year-old teenage girls in schools via a national immunization program. It is provided free.
Yes.
But it is important to ensure that we give the vaccination early because prior to exposure to sexual intercourse, of course.
And that is why you said that for women who actually have, early stages of sexual activity, they are also more prone to it.
Yes, that's why.
The vaccines did not have enough time to take action.
Yes. And of course, practice healthy lifestyle. Abstain from smoking.
Absolutely.
Yes, absolutely.
I think that is clear in every kind of cancer. Like stay away from smoking.
Yes. Smoking is a precursor for many cancers.
Yes, absolutely. It leads to lung, it leads to stomach, it leads to just about everything.
Lung cancer, ovarian cancer, a lot of cancers.
Absolutely. First things first, stay away from smokes. Now, of course, doctor, you have shared with us a lot. Now, if the general public want to know more, they want to know what their options, they want to know what should they be doing and all of that, where can they actually go to learn more about cervical cancer?
Okay. Our official website, okay, our Bahagian Pembangunan Kesihatan Keluarga, KKM, okay, our website. And we also have Instagram, BPKK underscore KKM. Okay, we have a lot of information, infographics on cervical cancer. We also have our Facebook, Bahagian Pembangunan Kesihatan Keluarga. And KKM also has Facebook and Info Sihat.
Okay.
That's the official ones lah.
So, of course, these are some of the places where our listeners can go to get more information about
information on HPV, all that, or in those sites that I mentioned.
And not only about that, also about an assortment of other issues that they might face, right?
Yes, yeah, not only on cervical cancer.
Absolutely.
But all about health issues are all in that.
They always say a happy man is a healthy man, so and a healthy man is a happy man. So that is something that we can definitely strive for. Now, Doctor, before we let you go, is there anything else that you'd like to tell our listeners?
Yeah. I want to stress time and time again that it is important to get yourself screened according to the schedule. Okay? If you are 30 to 65 years and already married or have had sexual intercourse, please come to any health clinics for pap smear or HPV test. Please don't be afraid or embarrassed, as now we already have HPV test. Soon, it's going to be available nationwide. And the most important message I would like to share is let's end cervical cancer together.
Lovely. Thank you so much, Doctor.
Thank you very much, KG.
And you have a good day, and have a happy holiday for a couple of days.
Same to you.
And we hope to have you here again.
Yes, thank you very much.
All right.
Okay. All right.
Thank you so much, Doctor.
Okay, bye.
And that was Dr. Shazimah Abdul Samad. Today we talked about ending cervical cancer. And for our listeners out there, if you are even a little bit, just a small bit suspicious about something that might be happening in your body, make sure that you go and get it checked out. You know what? Stay healthy, be happy, all right?